Hey everyone, welcome to the Psyched to Practice podcast, your one stop for practical and useful clinical information, masterful insight from experts in the field, and a guide to daily living. I'm your host, Ray Christner, and with me,
Paul Wagner.
So Paul, today we're kind of linking our thoughts from the past to our experiences of the present.
Yeah, no, that idea of like taking a look back and, sharing some of the insight and the lessons that we've learned, hoping to paving an easier path for those that are maybe newer or fresher into the field.
Yeah, I mean, I think, we definitely over time, the things we acquire skill wise and just knowledge wise, it was fun for me to kind of look back and go, gosh, yeah, man, it would have made my life so much easier if I would have thought about this early in my career. So yeah, it was, I think, an interesting topic. And, I think for me this week, the theme that kind of ran through almost all of them was this idea of just accepting kind of being uncomfortable, whether it's with issues of boundaries or not understanding business, whatever it might be, embracing the fact that that's okay and using that, in fact, maybe push ourselves out of our comfort zone so that we can expand and maybe do things we never thought we could do.
And, I think for me, my takeaway is actually one of those things that's uncomfortable, that's still trying to understand, which you actually kind of named it there, the business part of things. Mm-hmm. And, you were sharing some of that. And I still find myself really kind of being maybe at times blissfully unaware, but also just that idea of being unaware means that I can't then respond or react intentionally when called upon or when it's needed. And so, working to familiarize myself with some more of the business aspects and really the process behind it, because for so long I took it for granted. And so, I'm what I wish I knew then, but I'm at least taking the time now to learn.
Yeah. And yeah, I think if we would record this episode 20 years from now, we'll have a whole bunch of new ones in between. So I don't know if this is an episode that ever stops. And those of you listening, as always, we'd love to hear your thoughts of what maybe you wish you would have known that you now know. We'd love to hear your comments. Join us on social media or just message us.
And with that, we hope you enjoy this practice in action episode, What We Wish We Knew.
Well, Paul, today we're going to take on kind of another broad topic.
Yeah, no, an interesting one. And, I think it's not uncommon, on like social media and like these different areas where we have different professionals or even just different, individuals that have an interest and a variety of then like kind of, I guess, experiences there. So we have, people with a lot of experience connecting them with people who really are kind of new or green to the field. And, it kind of sparked this idea of what if we do an episode on this? What if we talk about, our experiences that we've had just being in, mental health practice and mental health, and really kind of taking a look back on, man, what do we wish we knew? And so here we are.
Yeah. And, it's interesting when you kind of brought this topic up, it made me think of being a parent. And I remember kind of just going through that early process of parenting and going, man, I wish I would have known about this beforehand. And you read all these books and all these things, and you still just don't feel like you have all the knowledge you need. I think professionally, I think what's interesting about this is, not only don't we talk a whole lot about it. I mean, I think sometimes we do, but there's not a lot written about it either.
Yeah.
Like there's no book that tells you all the things you wish you would have known before you got into mental health. Maybe that's one we do. I don't know. It would be interesting, but yeah. So I think this is kind of an interesting take, and it really has made me reflect just kind of my whole career, just thinking this through. So where do you want to begin? What are we going to start with?
Well, one thing, and when we posed this question, I was sitting down to jot some notes down. Really, the first thing that came to mind is the idea of boundaries. And, boundaries, not a new topic to the podcast, but especially this idea of, just really not feeling comfortable setting boundaries, either for myself or with clients early on. And so, I found myself either overextending or, being too flexible or maybe not being flexible enough, in some senses, and really just having this idea of like, what are my boundaries? And I think it took a while for me to figure that out for me personally, but it wasn't really on my radar to even start working on or figuring out, and something that had I known and there been a more targeted focus there, I like to think it maybe would have helped me feel a bit more stable, especially in that early time frame where it felt like I don't really know what I'm doing. I have this grad school experience, but I don't have the practical experience yet. And honestly, the accompanying thought with that idea is, one of my supervisors early on said this, and I don't, even now I find myself appreciating it, the idea of don't work harder than your clients. And so one boundary I really try to bring in is, I don't want to do all the work. So, just I think a really important topic. We can go a variety of areas, but yeah, Ray, what are your thoughts on that?
Yeah, I mean, I think boundaries are definitely an interesting thing that, I think my experience was I was just told about how rigid boundaries should be. And, and it was, maybe the opposite end where I was so over concerned about crossing a boundary, and they're just not as black and white as we'd like them to. And I think there's, so I think of boundaries in a couple of different ways. I mean, I think it's that don't overextend yourself, be able to say no, but also, the boundaries of we live in a small town, and what happens when you show up to a football game and one of your patients sits in the row in front of you. Like, no one talks about that in grad school. And I remember the first time that, really happened to me, I went back to my supervisor, and I'm, like confessing, going, oh my gosh, like I was in a football game. I didn't move my seat. And he's like, whoa, like you don't have to, you don't have to do those things. It took a lot of years for me to get comfortable with those kind of things happening, and being able to still have a very kind of strict boundary, so we're not boundary crossing, but also realizing that life happens and people are going to show up places. And I just had a conversation with a friend of mine who went on vacation many states away from where she lives, and in the room next to her, she walked out and it was one of her patients with their family. And she's like, how do you prepare for that? Like, how do you handle, so yeah, I think boundaries in a lot of ways. I wish I would have known more early on. And I think over time it does get easier, but it's a learning curve.
And the idea of like when those situations happen, like, there's a variety of times that, again, small town. And so, either someone I know personally, I, didn't realize the last name, and all of a sudden I'm interacting with someone, and just taking a deep breath and being able to kind of sit and say, okay, what's appropriate, what's not, whether that's working it out with the client themselves and kind of explaining those professional boundaries, and really not having a dual relationship, or seeking supervision and just getting some feedback on it. But it doesn't have to be that crisis moment, and the ability to have a conversation with it. And certainly I wish I would have, had that earlier on of, hey, take a moment and then talk it out, professionally, ethically, what are your responsibilities? What is seeing this person in, a restaurant or the football game? What is that really going to do? Best you can, try to, reduce that, but also don't live a smaller life because of it as well.
Yeah. And I think on the other end of that is that boundary of really being able to make a decision that is good for you as a therapist and not compromising it because you care. I mean, so, I had a situation, it's been several years ago, kind of similar to what you were saying, like didn't recognize the name, didn't like put two and two together. And the person showed up, and it was somebody that I had interacted with in a number of occasions, like basically, a friend of a friend situation. But, we were at this person's house. We were, very social, very friendly. It was not going to be good. And he kept going, well, I'm coming to you because I trust you. Like, and I like you, like, this is going to be good. And that was one where, again, standing back and going, can't do this. Like, this is, I appreciate it. It's great. And, we're not going to overreact to it. We're going to talk today. We're going to figure out a plan about who we can get you in with, but I'm not the right person. Being able to, use that calm and go through. I don't know if I would have done that, my first 5 years of being a therapist. Over time, I'm comfortable in my skin to say that and know that I'm not going to offend people by doing it.
And realistically, for the clinicians that are early into the field and coming in, I don't know that you're not going to panic and not going to have that,
Right.
kind of like, oh shit moment.
Yeah.
But being able to maybe pull on some of these ideas of it doesn't have to be a crisis, and, okay, how do I work through this? And, you'll still have the panic, but maybe we can reduce the duration and the intensity a little bit.
That's right. Yeah. And I think, also, again, what comes with experience is, how I talk to people my first session now is different. I mean, because I know I'm going to run into people, I say that, first session, this is going to happen. And again, I wish I was better at it. I was pretty clumsy, I think, for a while, but now it's pretty easy to do, and something that over time I think does get easier.
Yeah. Well, and, speaking of things over time that, that were starting off very uncomfortable, the idea of finding comfort in silence. And it actually, I remember a grad school professor sharing that idea. But the first time I had to sit in silence and just that true, like, it's a somber moment or it's a heavy time, and not wanting to fill the dead air because the silence is therapeutic. That was really, really hard. But that was actually something where I had a little gleam. And so I pushed myself to experience it. Did not make it any, didn't make it necessarily, all of a sudden I'm comfortable, but something that I wish I would have attended to more, and being able to prepare for, okay, if there is silence, and in my personal relationships, how can I practice that? There doesn't always need to be a banter back and forth, especially in heavy moments. How do you, how can silence be comforting? So I think that was a really, like, that was thinking back, a memory that came back. I was like, hey, I wish I would have been more comfortable sooner.
Yeah. And my experience was probably a little different than yours. I had this great professor when I was doing my master's degree for therapy. And one of the exercises we did in class was he would pair us up and we would sit in silence and just look at each other. And I remember being in the class going, how silly is this? Like, it's like, I guess I was probably early 20s at that point. And like, that doesn't make any sense. Like, when is this ever going to be useful? And, gosh, in hindsight, I kind of go, man, did he do a brilliant thing? Because the first time that silence happened, I was okay. Like, I felt really good about it. Like, so, it was interesting. I wish I knew how valuable his lesson was when it was happening, but I didn't have to experience the discomfort later, which was a good thing.
And, maybe speaking on that, and I think that actually the way you're describing it, I don't know necessarily from a grad school course other than maybe some insight from it, but being comfortable with tears as well. Like, it's not someone starts crying and you immediately hand them a tissue. And I think that's a pretty common conversation in grad school, but how can just letting tears flow, letting tears out, like, for individuals really be valuable? And, I'm actually wondering, like, the idea of us crying and, if there's something that's really heavy that touches us, and, like, can it be appropriate for us to shed a few tears in session, and empathetically with a client? And so, going back to some of the boundaries pieces, but I think when we see duress, we want to comfort, but that's not always the point in therapy, and keeping that in mind, because it can be a really powerful tool.
Yeah. I think the lesson in that situation for me, what I wish I would have known was, I think through my training, I thought I could easily separate that. Like, I think that I didn't realize how attached you do get with people and how connected we become. And that when they're upset, yeah, like we have a similar emotion, and that's not a bad thing. I mean, you got to watch what we do with that emotion. But I think through my training, what no one ever told me was that was going to happen. It was just kind of, hey, we can compartmentalize this and you're just going to go in. And that's kind of what I thought. And I think initially, like, when you're doing your practicum in your master's program and you have 1 or 2 clients, 3 clients, that's not too hard. And then all of a sudden, your first job, you're seeing 30 people in a week. And then that becomes more of a toll. And I'm not sure I was ready for that. I think that I thought like, oh yeah, I can do this all day. I'm going to get in my car. I'm going to go home and that's it. And I do think we get better at it. Mm-hmm. But the first time I felt something in a session where it was like somebody's talking and I'm going, what's going on here? Like, why am I feeling emotional in this? I think I was surprised by it. I don't think I was prepared for that.
And I like how you put it of like the giving ourselves the permission to experience, but also we have to be intentional with how we use it or what, address it in the moment. And so if it's, us being able to, maybe it's modeling, holding composure while also experience, if it's us being able to use it as a tool to empathize and connect with them. If it's maybe, potentially, if it's us needing to take a moment to acknowledge that something's being triggered and that, maybe there's a bias or maybe there's something coming up for us. So I think, just being able to reflect on that and not pushing it away or not kind of wishing it away because, it can be a really effective tool there.
Yeah. And we are human. So that's going to happen. So,
and, maybe a bit of a deviation from some of the more emotionally connective pieces that I wish I would have known early on. Get organized. Like traditionally, I am not the most organized person, and man, does it come back and bite me in the butt time and time again. And probably starting in kindergarten talking about organization, and yet still finding myself surprised when it feels really overwhelming because there's mismanagement of things, and certainly much better now than I was initially. But keep track of your paperwork, keep track of deadlines, know when notes are due, have an idea of these different pieces because it can very easily pile up or we lose track of things. And it just makes things so much more challenging and so much more work for ourselves when we're already feeling overwhelmed early on.
Yeah, I agree. And I think the lack of preparation we have for the administrative burden that we take on in these roles. I don't know that we're ever prepared. We're prepared for that. And we learn how to write notes and we learn those basics, but again, you have now 30 of them due, or you have whatever it might be. How do you manage your day? And on top of that, how do you manage the fact that you're going to get thrown clinical curveballs along the way that you're going to have to research and you're going to have to plan and you got to get ready for your sessions. And, there's so much, I think, that comes in the role that has nothing to do with what's going on when the therapy door closes. And I think that's definitely, I think we're not prepared for it. And then I think too, no one really tells us how to organize it. And maybe that's because organizations may be a little personal in what works best. But, when I've taught classes, I've been kind of intentional in saying, like, think about how you're going to do that. Like, how are you going to plan your days? Like, when are you going to prepare for your sessions? Are you the person that wants to prepare the night before and you look at your schedule ahead? Are you somebody that's going to come in an hour early? Like, how's that look for you? And getting people to think that through. I know I've gotten, I think probably the second half of my career has been so much more organized than what the first half was. Part of that's because maybe I embraced some of the technology that I went like, wow, okay, I have all these time blocking softwares that I can use. And I do those things and really have embraced using them. And it's made me much more efficient. But I don't think anybody tells us that.
Yeah. And, you're talking about organization being a personal thing. And so I think maybe the valuable thing is, being aware of the structures or the stressors or the responsibilities that belong in the field. And, whether it is preparing the night before, preparing, morning of, finding out what works for you. But if you don't think about it, then you don't know to prepare for it. And, it just kind of puts plants that initial seed for how will I approach this? Doesn't mean it's going to work. Probably won't, the first time around, but
Right.
At least we're not trying to figure it out on the fly, and we're going in with some sort of organized plan.
Yeah. And I had not a supervisor, but a friend of mine one time, I remember saying I was behind a number of reports and I was complaining about it essentially. And he went, "So how long have you had that problem?" I'm like, "It's always that way." I'm like, "Every year I feel like I'm behind." And he's like, "When are you going to do something different?" like at what point do you stop going, "Oh, I have all these reports and I'm always behind." And he's like, and it was funny because I honestly think that was like, he said it kind of in a smart ass way that a friend would say it. But for me, I went, yeah, like why do I keep trying it the same way and it not working? Like if I had somebody come to therapy and tell me that, I would be like, they're not following through with what we're working on. And, so I think the other part to this that I wish maybe I would have known is, don't get stuck in a pattern too long that's not working. And I know that for other people. I'm not sure we know that for ourselves. And, if every week I have a to-do list of notes that I'm rushing to get done, then I'm doing something wrong. And now I think that over time that's become better for me, partially because someone called me out and I went, yeah, why do I just keep admiring the problem without a solution? And that let me be more thoughtful in kind of how I approached it over time.
Yeah. Well, and I think that lends itself well to this next thought that came up when we were kind of having this early discussion. And it's almost kind of a two-part, the idea of, don't overreach as well as accepting being wrong. And so, that like, okay, hey, this isn't working. I need to be able to accept that and, being able to work through that. And, I think initially that thought came up thinking about working with clients and like, this is the thing that's going to help, and
right.
being overly confident in, in this. And then they try it earnestly and they do it well, and it just doesn't work. And, not then keep, again and again and again. If it, we have to then be able to accept and pivot and recognize, okay, yeah, I missed that. Or I can, now say I handle it much more gracefully, but when I throw out an idea or like, hey, this is what I'm hearing. And, the client say, no, like, no, that not at all. Like not then like, deer in the headlights and trying to convince them that I'm right, but rather hearing them, recognizing they're at least the experts on them, like, on what they're experiencing. I might be able to then help shape and guide to make them more successful, but we can't tell, it's almost like telling someone they're not feeling the way they are. It's like, we have to accept it, be like, okay, how do we step back and really check ourselves a bit and accept that? And then this idea of overreaching, I think early clinicians, because they don't have an expertise, try to become experts in everything. So they take on a variety of cases. And honestly, I don't know that that's a bad thing. But if we frame it as I need to be proficient in all of these areas, I don't think we're necessarily doing good work. But if we can approach it from this, I'm here to learn and apply what I know and feel what I do well with, and being able to then learn for ourselves, some of those maybe more specializations we'd like to get into, but not trying to really kind of tout ourselves as an expert in everything, because that's not how expertise works.
Right. Oh, yeah. And I think, unfortunately, maybe we see that more professionally, where somebody will take a 3-hour training and they think they're an expert in something. And I think we have to always be cautious of that. And I think for me, the best thing happened to me early in my career was, I had a heavy caseload, but I would say that probably 70% of my caseload was pretty narrow, in the sense that they were general life problems, maybe some mild anxiety, some depression, but I wasn't really practicing a broad array of skills. It was a pretty clear focus with most of the people. And then I had these outliers of, the other 30% that challenged my skills. And that was such a benefit to me that I had that opportunity, because then it did let me broaden a little further. And, never did I still don't feel I'm an expert at anything. Like, I think it's all these things where we're like, we're always trying to strive to have more expertise, but it gave me a way to really focus on some other areas. I appreciated that piece. And again, wish I would have thought a little bit ahead of time about those things. And I want to go back to the being okay with being wrong. I think that's a big one that that is definitely I wish I knew, because, I remember the first time I didn't make progress with someone, and I just couldn't figure it out. And I kept going, it's an evidence-based treatment. Like, it's supposed to work. Like, I have all these studies that prove it, and it just didn't. And the fact that it didn't, and being able to kind of accept that and not be stuck in a rut where I was trying to push something that wasn't working, being able to step back and go, okay, like, I'm missing something, or this isn't the right thing for this person, I think is such a benefit for us therapeutically to help people. But I think for ourselves, reality is we can't help everyone. And it's okay to be wrong. I think that's, when we've done an episode about case conceptualization. It's what I love about case conceptualization, is that we create hypotheses, we see if it's going to work. And when it doesn't, it just means that we need to adjust. Maybe it's not a right or wrong. It's just, we need to know when to make changes.
Yeah. And I would almost like to actually call out the opposite side of be okay with being right and accepting it, and almost like viewing yourself as a professional. And I can think back to early on, almost trying to share ideas, but then almost trying to ask for permission to share the ideas. And, these individuals are coming here to see me as a professional, and I need to then recognize that role. And I think that was something that at times I didn't necessarily think about and see, but, we've gone through the schooling, we've gone through the training, and certainly we are going to be wrong sometimes, but we also have to recognize and accept that we're going to be right. And speaking as an authority and speaking with, the not overreaching, but within our wheelhouse and within the training that we've had, how do we operate within the scope of our profession or the scope of our training? And I think that was something that took me a while to recognize and learn that I wish I would have known earlier.
That's a really good point. I don't think I ever thought of it like that. As you say it, I kind of go, yeah, it's so helpful to be able to trust the skills that we've obtained and to be able to put those to work. And, maybe it goes back to a word we've used in many episodes. How do we create this harmony with ourselves of being confident enough to take leaps and to show people our skills and to push and to think that we're right, but to also have the other end of that, to accept when it's not going the way we thought it was going to go, and that, having that kind of back and forth. And so, listen, I think people that we work with respond better if we do have some sense of confidence in what we're sharing with them. But I think they respect us more when we recognize that it also might not work all the time and we might have to shift.
Yeah. Something I love doing in therapy sessions, and I find it connects probably the best with my tween to early teenage clients. But I think even beyond that, it's effective. But I think they're just also kind of learning about it in school. But I like bringing up the scientific method, and I like talking about, hey, we're going to create a hypothesis, and we're going to then manipulate these independent variables, and we're going to see the effect it has on the dependent variables. We're hoping it follows suit with the hypothesis, and we can then kind of work to reinforce this and build off of it. But if it doesn't, it's valuable information as well. But we have to then be able to be willing to come back and, either find different independent variables to manipulate or different ways of manipulating them, or updating our hypothesis if we've explored the relevant independent variables for that to try to create change. But and usually the kiddos that are a bit more science inclined are like, yeah. And then like, they don't think about it in that way, but then, we have them running their own experiments on themselves of like, let's give it a try. Let's run a failable experiment. If it doesn't work out, that's okay. It already hasn't been working out. So, it's just not working a different way. So it's, I think, a way of sparking interest and curiosity that I find to be very effective.
I agree. I think, it's, and again, I think we get better at that, being able to create curiosity in therapy I think over time. And again, I think I fumbled at a early part of my career, fumbled with doing that more. And now, I think it becomes much easier.
Yeah. And, maybe along those lines, and actually something you said, it reminds me of something someone else said on a very early episode of the Psyched to Practice podcast, Dr. Robert Friedberg. And, I've kind of gone back and we've done some clip episodes and, listening to some of the various early episodes. And, something that Bob was talking about early on was, have a strong fundamental understanding of the model, the therapeutic model, but then be creative with it. So he doesn't want, his early, doc students to be going out and, making up their own therapeutic approaches, but there's value in practicing, the core concepts of the model and getting a strong foundation with it, but then taking risks. And, I think I maybe even touched on this earlier, but the idea of, don't feel so rigid and don't feel so constrained by these things. And, as Michael Alsey in another episode, or, Simon Rago, and, we just talked to Sandy Pimentel, Kirsten Suhani, and Jason Von Seitz were talking in our metaphors episode. Yeah. We can find different ways of bridging and presenting this information as long as it holds true to some of the core principles. And, I think that that's something that early on, I did not feel comfortable getting creative or using improv. It was, and maybe, over adherent, overly rigid, and not really then making it connective. And I find so often, if I can form connection in the therapy setting, that's when we're really making some change.
Yeah, that episode with Bob was actually one of my favorite we did, just because of the respect I have for him. And I think his point's great. This idea of let's get really good at the model, and then let's really take risks. And I think, Bob's the perfect example of that. Like, I mean, when, that episode, when he talks about the time that he was presenting about what he was doing with cognitive therapy, and Aaron Beck came in the room and sat in the front row, and, that idea of how uneasy he was, that here he took this model and all of a sudden, he's using games like Simon and all of these things that don't sound anything like cognitive therapy. But, Beck's response being, you tell me what you do and I'll tell you how it's cognitive therapy, and how embracing he was. I think that's just a great example. I mean, I think his whole story, because Bob's work has expanded the field of cognitive behavior therapy with kids tenfold. I mean, if you look at works that were and books before his time, it was basically taking adult therapy and trying to just tone it down for kids. And then Bob put this big spin. And part of the reason he could was he was such a master of the theory of cognitive therapy, and his skill level. And then he took it to another level. And so his story has always been a motivator for me. It's let me take risks. So yeah, I'm glad you brought that up. I think that as we, as young professionals, I think want to become experts, maybe that's the best story that's out there, is pick something, really just get into it and really learn it well, and then make it your own. I mean, I think that's, and again, I don't know that we learn that before grad school or even in grad school. But the people I respect most in all aspects of psychology and mental health are the people who do that. They know the foundational knowledge probably better than anyone. And then they do something with it that is, takes it to a new direction.
Yeah.
And I think in third wave CBT, we've seen that happen, over and over. Marsha Linehan's work in DBT, she took CBT and put a twist and added things that has become, if you say DBT, most people know what it is today.
Absolutely.
Even people who aren't in therapy, like it's become such a widely known kind of model. And ACT's doing the same thing. Like we're seeing all of these areas. That's how you change your career path, I think.
And the different waves of CBT are all just that. It's taking this strong foundation and expanding it. And the people that we're reading about in our graduate programs or our doctoral programs, they were new as well, but they took those risks and they expanded. And one of our guests, Dr. Ryan Delap, I think he being I think a younger professional, but also really having this creative approach to therapy and, finding this niche area, but, he's not making it up on the spot. He's pulling from these past experiences, but finding a new and creative way of blending them and putting them out there, writing journal articles, presenting about it. So, certainly I think promoting the profession and not being afraid to have an idea and explore that idea. And I think even Bob talks about, collect some data, run some experiments, see the effects of it. And so I don't know that I think a lot of professionals enter the mental health field really think of themselves as potential pioneers, but man, what's the value if we can view it as like, I can be a pioneer. We don't all have to be, but if we don't even necessarily put it on a table, maybe we don't take some of those healthy risks to start with.
Yeah, I think that maybe leads to a really, I think, important thing that I wish I would have known. And I think early in my career, I didn't realize and I'm going to use the word business opportunities because I think that's how I view them now. The business opportunities that we have as clinicians. And part of that is coming up with ideas and, thinking and seeing something and taking it to a different level. And, early in my career, all I thought about was going to an office, seeing people through the day and going home. And that was it. And then, when I did my doctorate, my mentor, Art Freeman, I'll never forget, we were at a conference and he said, let's go down to the floor, which is, basically this huge ballroom that has all these vendors. And he's like, let's go down and talk to publishers. And I'm like, oh, or, you want to buy, or is there a book you're looking for? He's like, oh, I'm going to go sell them some ideas of books I'd like to write. And I'm like, what, you do that? Like that's an option here. And he's like, yeah, and so we go there and I think maybe I've shared this story before, but he puts me on the spot. We're talking to a acquisition editor at a publisher. And he says, Ray, tell him your ideas of the book you want to write. I had no idea of what book I wanted to write. And on the fly, I did. I started just kind of talking about ideas that I think I've always had in my head. Like, I think they were there. I mean, it was not like, I don't think I really made it up on the spot, but never did I think I was going to turn that into something. And idea became the first book that I was on. And it was fascinating. I learned so much from him about that idea of opportunities. And, and he would always say, he said this a million times in class. He's like, just because it's done before doesn't mean you can't do it better. Like if you see something, it's an idea, how do you take it to the next level? How do you expand it? And I think all of these people that we've had as guests, I think that's what they've done in their careers. I mean, it's, they've just taken and made a different spin. And I think we're all capable of doing that. But it's understanding the fact that there's more to this career if you want it to be than just going in and doing therapy and going home. There's a lot of opportunities, whether it's writing or presenting or consulting. I was talking to a person just a few months ago who was a psychologist who was a consultant on the the Disney movie Inside Out. And I was like, oh, that's pretty awesome. Like, how did you get that gig? Like, how do you become? And she was telling me the story about just, she put herself out there. She was like, wow, I would love to see a kid's movie about emotions. And so she talked to people and she networked and she did all of these things, and then found herself, in a studio helping people write a script, which was fascinating. So yeah, I love that idea. I think that's an important part for people going into this profession. The things we do every day are wonderful, but we don't have to be bound just to those things. We can diversify our careers and do a lot of things. Maybe even do a podcast.
That was like that.
That's right.
I don't know that I ever pictured myself early in the career from having a voice, sending it out to different listeners, and here I am. So absolutely,
yeah. I mean, I think that there's so many opportunities, and honestly, I think it's so exciting, and I'm so glad. I mean, I've said a million times, my career was never supposed to go the way that it went, but man, am I happy that it has, and it's taken me all different places and let me meet a lot of different people. But it's understanding the fact that there's more to that. So, when I go to conferences, I go there for education, I go there for networking, and I go there for business. And, it's really a blend of a bunch of different things. And,
that idea of embracing being uncomfortable. And I think a lot of I could probably find a way of putting a spin on just about every single one of the topics that we've talking about of, this idea that and we learn it in grad school, or we learn it in our programs as well. Discomfort isn't a bad thing. Discomfort is, maybe a current state of being, but how do we either cope with that well, or how do we work to resolve it? And in that, pursuing, creating positive changes and growth for ourselves. So, whether it's creating an organizational system, sitting in silence, taking some business risks, or, putting yourself out there, I think the value of, sharing our voices and, being able to share the information that we've learned and, within this profession, whether it's in the session or in publication, in social media, in podcasts, or, with Disney movies, just kind of growing and promoting the good stuff.
Yeah. Yeah. I mean, I agree. And, I think maybe one that we can kind of maybe end on today is, just taking this idea of the business and that discomfort. The other business discomfort I think I wish I would have known more about is things like insurance. And
we're talking about discomfort. Yeah.
Payments. Yeah. Right. That's the real discomfort in business, and I think that it took me a long time to understand the business of mental health. And, not that it's always fun to learn, because it really isn't. And sometimes it's depressing to learn some of the things about business, but knowing them, I think, can help clinicians think differently, just understanding what is reimbursements for insurance. And, it's wonderful when people say, I want to make $100 an hour, but if insurance only pays $60 an hour, that's pretty hard to achieve. And understanding some of those things and maybe the bureaucracy that comes with it, how hard it is sometimes to get claims. And, I remember not knowing, and not knowing made me frustrated, because I was just making assumptions about things I truly didn't understand. Now, that doesn't mean I'm not frustrated now with some of the stuff that happens with insurance and things, but having an understanding, I've been able to do better at having workarounds with it. I again, over time, I learned that, you can't take a low paying insurance for everybody you see, or it's going to be hard to survive in a company or as a business, and learning how to diversify streams of revenue. Those are things I never even thought of until way after I was out of grad school. So I think, I wish I would have known the business stuff better early in my career. And even if it wasn't that I was opening a business in it, I think even just new clinicians that are going out, try to understand it, understand how your pay gets to where it is and how you make the money. How does the company make enough to pay you? And, it's not like everything that comes in can go to clinicians. There's office expenses. There's all those things. I just never understood it. And then when I did, so much more made sense to me.
And I think it's something that I still don't know, and
Yeah.
thankfully, I think I'm learning it now, but I think it would have served me well, certainly early on, when looking over some life, like, when I'm looking into, do I want to work for this community-based mental health agency, or, that idea of like, oh, private practice, is kind of talked about a lot in grad school, and, just having the nuanced understanding of what all goes into those pieces. And I think that's an invaluable skill.
It is. And I've been lucky. I get to consult with a number of practices on business aspects. And I think that's the part that's interesting is how many times I've gone in to consult with someone and what they think their business is doing and what the reality of what it's doing is two different things. And they can't understand why they're struggling to survive. And, it's this idea of, but look, I'm bringing in $200,000, but I can barely make, payments, and I'm not even paying myself. And how's that even possible? And, they look at this revenue number, and, I one of the things when I consult, I always start with is I'm like, I actually know how much it costs per roll of toilet paper in my office. Now that sounds ridiculous, but it's an expense. So it's an expense I have to understand. I understand what my electric looks like if my office is open all day. I understand what the electric's like when the office is closed. Like all of those little nuances, they all add up. And I think businesses that get in trouble, that's because they don't realize that everything has a cost to it.
Yeah.
And that doesn't mean not to do those things, but it means to understand it. It's, as simple as, I just had this conversation with a practice that they didn't want to change a heating system in their practice. And instead they ran space heaters. And I said, well, how much do space heaters cost you for electric if you do it? And so we started adding things up. They could have bought a new heating system for their office probably 3 years ago based on what they have expended doing all of these other things, but they didn't think they're, again, grad school doesn't teach that.
No.
But sitting down and being able to learn those things, I wish I would have knew it earlier. I'm glad I know it now.
Yeah. And, I think certainly maybe a good point to start pulling back here. And, maybe one of the last messages to put out with this conversation is that, the similar to therapy, the expectation isn't that after listening to this, you're an expert. The hope, I think, is that it creates more awareness for you to then go out and explore and learn and research and trial and error things for yourself, working to create comfort, but recognizing that, especially early on, maybe we doubt ourselves in that. And so working to spark the confidence to take risks, make mistakes, believe in yourself, learn, become business savvy, and continue to make a positive difference.
Yeah. And I think, I would challenge, no matter where anybody is in their career, ask yourself what you don't know. I still do that all the time. Like I sit back and go, okay, what is it that I don't think I know well? And not to be afraid of that. I mean, I think because it's something that's different. Even, while I might understand business parts of it, there's times I'll go, what, I really don't know the billing end that much. And maybe I'm going to take a dive into how to actually bill insurance. I have no plan on ever doing that. But I appreciate the fact that I know it. And so whether it's business or any of these things, I think everybody should just take time and just sit down and go, okay, what is it that I don't know that I want to know about? And I don't know, for me, I think it makes our careers more exciting.
I think so. Well, with that, we hope you enjoy this episode. Please join us next week. But until then, be well, stay psyched. The information contained in this podcast and on the Psyched to Practice website is intended for informational and educational purposes only. Nothing in this podcast or on the website is intended to be a substitute for professional, psychological, psychiatric, educational, or medical advice, diagnosis, or treatment. Please note that no professional patient relationship is formed here, and similarly, no supervisory or consultative relationship is formed between the host, guests, and listeners of this podcast. If you need the qualified advice of a mental health professional or practitioner, please contact services in your area. Similarly, if you need supervision on clinical matters, please locate a supervisor with experience to fit your professional needs.